Hello, everyone. Thank you so much for joining us today, for spending your lunch hour with us. I know I can't see y'all out there, but I feel you as we are all feeling love today for the United Way, such an incredible organization who help so many folks in our community. So a big hearty welcome to the first of our Getting to Know the Core series. Now, this is a series of virtual events that will look at the important issues that face our county's residents. This first event today is going to be focused on something that we can all agree is a big issue: mental health. So we right now are live on Facebook, Twitter, YouTube, and the United Way of Snohomish County's website. So please like, comment, share, tweet, retweet, and tag your friends. And then also let us know which company or organization you're with, and then we'll show it on the screen. So the series of events starts with the big picture of the trends in Washington State, and then we're going to go and bring you through our core work and experiences of our families. We're going to hear first from Allie Franklin of the Behavioral Health Institute at Harborview UW Medicine about the needs and works that BHI is doing to lead on these issues. There's a lot of work going on there. We're going to dive into that work and then our impact and investment led by Fay-Cruz, who is doing what she's doing with our core collaborative partners to bring light to the firsthand experience of possible systemic barriers. Many thanks to Child Strive and Housing Help for helping us to make this event possible, really. I also want to introduce our panelists who will be heading up today's discussion. Thank you for being here, ladies. Jillian Douglas, Sarah Pulliman from Child Strive, and Sharon Kremen and Cate Brewe from Housing Help. We are really looking forward to this today. So United Way of Snohomish County is embarking on the second phase of our core work. This next phase of core is focused on identifying barriers and then finding ways to address them. So today's panel discussion will focus really on what we are seeing in Snohomish County and a bit of a show and tell of the whole process to give you an idea of what really goes on. And finally, if you have questions or comments, just use the chat to relay these messages to our producers, and then we'll get them to the people who can answer them for you. We're going to get all those lined up for the Q&A segment of our program, and you don't want to miss out on that because that's a really awesome opportunity for all of us to get involved. And speaking of involved, I'm really, really honored that I'm here today. I know King 5 is a huge supporter of United Way and mental health issues, but me personally, it has been a challenge and a great reward for me to be able to not only talk about this issue on the platform of King 5 and New Day, but because I've had my own challenges that I've had to deal with. And I'm so happy to share with you that everything can be changed in someone's life by putting the right resources towards mental health. I experienced it when I lost my mother and my son was hospitalized. I wouldn't be where I am today without the help of my therapist. So I hope we can all agree how very important this is and how grateful I am to be sharing this message. So we will be posting some resources throughout the event to help everyone find the right way and path. And a good number to have on hand, I just want to get this out there right away, is the National Suicide Prevention Lifeline. That is 1-800-273-TALK. Again, we invite you to use the chat to ask any questions throughout the event. So please make sure to press play on the video on Facebook to make sure that you can see your questions, and go ahead and share all of this on social media. And questions posted on Facebook and YouTube will be selected, by the way, and then added to this live stream. So FYI, the hashtag for today's events is hashtag UWSC Getting to the Core. So it's all together, UWSC Getting to the Core. And we do want to provide a quick plug today to donate to www.uwsc.org. United Way of Snohomish County is starting phase 2 of its core work. Now, this is an exciting time for folks to invest or even reinvest in our core work that help so many. Finally, this work would sure not be possible without our corporate sponsors. And so we want to take a moment to thank them. They're just more than just sponsors, really, for an event. They are active partners in this work. So please help us recognize our sponsors. Big thanks to Primera, which is our presenting sponsor, BECU, People's Bank, King 5, Jamco, Puget Sound Energy, Pertite Incorporated, Advanced Traffic Products, IAM 751, Keysight Technologies, Western Systems, BNSF Railway, the Cooper Family Foundation, Pacific Crest Savings Bank, Sound Credit Union, Coastal Community Bank, Pace Engineering, Sargento Foods, and Union Bank. Our new sponsors, and thank you for joining us, are Fairfax Behavioral Health and Community Health Plan of Washington. And both of those new sponsors are very, very welcome. Again, we want to say big thanks to Fairfax Behavioral Health and Community Health Plan of Washington. All right, my friends, now it is time to welcome Dr. Terry Cox, Interim CEO of United Way of Snohomish County. Dr. Cox has a background in higher education and workforce development right here in Snohomish County. Dr. Cox recently started COCO Consulting and has served in 2 interim director roles at Centralia College. Prior to that, she was at Edmonds College in Snohomish County for 5 years as Vice President of Workforce Development and Training. Dr. Cox is a graduate from the University of Washington with her doctorate in educational leadership. She also earned an MBA from Washington State University and therefore considers herself a Koogski, which I personally love. Please welcome Dr. Cox. I'm going to say what we've all said for years, 2 years now. Terry, you're on mute.
That wasn't supposed to happen, was it? That would, yeah.
You know what? I think that's the tagline for the last 2 years. You're
right.
On
Absolutely. Oh, thanks, Amity. You make this look so easy.
Not at all.
I get to root for both of our Washington teams, except when they play each other. That's the only time it's a problem to be a Koogski. Well, welcome, everybody. Thank you so much for taking an hour out of your day to join us. I'm so pleased to be here today for this conversation that's such an important topic, as Amity was saying there. This is our first Getting to the Core event. It's a series of educational events designed to bring both the large and the local perspective to local topics that we want to share about. CORE stands for Creating Open Roads to Equity. It's the centerpiece of our work at United Way Snohomish County. Our work is focused on helping families with children age 0 through 8 get out or stay out of poverty. And ultimately, we're working to create or empower systems change. We're talking about mental health today. Oh, and I do want to take just a second to thank my team at United Way Snohomish County for all their work in putting this together, and also for Digimentors for hosting and producing us today. The technology is great, except when you forget to unmute yourself. So we're talking about mental health today, and it's a really important topic for a lot of reasons. There were concerning disparities to the access to mental health before the pandemic started, and those have just increased over time. A recent study that United Way Worldwide did showed that families in poverty report elevated symptoms of anxiety and depression since the pandemic began at a higher rate than families who are not in poverty. So it's been harder on those folks who have less resources. There was also a Seattle Times article that you might have seen about deaths of despair, which are deaths from alcohol-related, drug-related, or suicide. And those deaths increased in 2020. And actually, there were more of those kinds of deaths than there were from COVID-19. So mental health is just a hugely important topic. But you don't need to hear any more from me. Let's get to the experts.
That's right, Terry. We have some people who are going to be talking about these key important events. And by the way, that is something I'd never heard before, Terry, deaths of despair. And that really kind of puts a frame around what we're dealing with.
Yes.
So coming up next right now, we are going to be hearing from many folks about the key trends and needs of Washington State with our next guest and keynote speaker, Allie Franklin. And then later in the program, we're going to get to the core of what we are seeing on the ground in Snohomish County to really give you an idea of what's going on. And in the meantime, we do, again, want to share an important resource in Washington State. crisis support is now being offered via text message. This is a great option for folks who maybe can't pick up the phone for many reasons. So I just want to share with you, and I want you to share with everyone else. All you have to do is text the word home, 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 to 741-741 to get help. You or your loved one will be connected to a trained crisis counselor for support. It's an incredible, incredible thing that we have here. And now we are pleased to introduce Allie Franklin, LICSW. Those letters mean that Allie is a licensed independent clinical social worker. She has more than 20 years of leadership and experience in the field of behavioral health. Currently, she serves as the director of behavioral health, the Behavioral Health Institute, which is a full-service, community-based outpatient behavioral health department at Harborview Hospital. Additionally, as if that wasn't enough, she is the administrator of behavioral health services at Harborview, which, did you know, is a hospital for teaching at UW Medicine. So her line of service at Harborview includes the Psychiatric Emergency Service, or PES, 3 inpatient psychiatric units that total 66 beds, to give you an idea of the scope of what she's overseeing. Now, previously, Allie has served as the CEO of Crisis Connections, one of the largest crisis hotlines in Washington state, and as the Associate Vice President of Clinical Operations for the Optum Pierce Behavioral Health Organization in Pierce County. She has had her hands full. And before that, even as a former captain in the U.S. Air Force, she brings a passion for fully integrated behavioral health and physical health care, and a commitment to continuous quality improvement, because we are continuing to learn and improve on the things that we can do to help folks. Allie, welcome.
Thank you so much, Amity, and thank you, Dr. Cox, and thank you, the United Way of Snohomish County, for inviting me today to come talk about this really important topic. As Dr. Cox talked a little bit about just in the very beginning, behavioral health has become such an important issue. It was always an important issue, but it's really been highlighted and spotlighted by this pandemic. Before I get started, though, I wanted to share a little bit around what is the Behavioral Health Institute. Lots of people know what Harborview is, Level 1 Trauma Center, and know about our outpatient and our inpatient care that we provide. But the Behavioral Health Institute is something that people don't know as much about. And so the BHI is a program of Harborview Medical Center that's dedicated to advancing innovation, and let's see if I can get the slide. Advancing innovation and in research and clinical practice in the community behavioral health sphere. We do this with 3 different pillars: the clinical services pillar, our training, policy, and workforce development pillar, and our research and program evaluation pillar. And each one of those is focused on a different aspect of how we bring innovation and improving access to effective behavioral health care across the state of Washington. Clinical staff come from Harborview Medical Center, and our faculty and physician staff come from the UW Medicine Department of Psychiatry and Behavioral Health Services. So I wanted to share a little bit. I was asked to come and talk a little bit about what are the current needs for Washington State in the realm of behavioral health. This map should look familiar. It's the state of Washington, but it's broken up into the regional support areas and regions in the state. And so I think that's important in thinking about how do we think about behavioral health care in the state of Washington, and what regions is it broken up into. You'll see Snohomish County is in the purple. That's labeled as North Sound, something some of you are familiar with. So what are the key issues that are really impacting the state of Washington right now? One of them is this increase in demand for behavioral health services. Behavioral health meaning both substance use disorder treatment and mental health combined to refer to behavioral health. And so what we see is that isolation, what I would call crisis fatigue. People get tired of there always being a new crisis during the middle of this pandemic, have really amplified the need for people to be seeking extra services. We see this in a couple of key metrics. So deaths by suicide, according to the American Foundation for Suicide Prevention, in 2019, death by suicide is the 8th leading cause of death in Washington. But even more concerning, it is the second leading cause of death for the age group of the years 10 years old to 34 years of age. So that's a wake-up call for us as a state to think about what do we need to do in order to wrap services around folks to prevent, to realize how do we care for the crisis that happens, and then how do we prevent the crises in the future. The other key metric that comes up is talking about overdose deaths. So for people who are using opioid medication or medications and drugs that end up being laced with fentanyl, what we see from the CDC is that in the 12 months that started with May of 2020 to April of 2021, overdose deaths increased by 28.5% across the US. Concerningly, in Washington showed a 29.2% increase. And so this is something we need to be paying attention to and thinking about as a community, because our residents, our people are dying, and we need to figure out how do we support them. How we support them really takes part in thinking about what is our traditional behavioral health service and what do we do on a regular and routine, but also thinking about the crisis system. When you look at this map with all of these different colors, what you see is a patchwork quilt of coverage. What you will also hear from me is that our crisis system is a patchwork quilt of coverage. And so that means that in different regions, there's a different array of services that are available to residents of those regions. And so if a person moves from one region to another, they may not actually have the same type of crisis services that are available. Another thing that's different about that is each of them right now is supported by a different crisis line. And so thinking about how do we support Washington as a state, and think about this in a coordinated effort to be able to say, how do we look at where are the gaps in our crisis system, and also where are the places that we need to strengthen the support that's available to people. The last thing about our crisis system that I'll bring up is that crisis system work is actually paid for differently in each one of these regions of the state. Some places are thinking about a fee-for-service measure where folks are paid, where agencies are paid when a service is rendered, and others are thinking more around a pay for capacity, or what some people call the firehouse model. You don't wait to bring all of the fire prevention folks or all the fire intervention folks together as soon as there's a call for the crisis. We have folks who are waiting on standby to be able to respond very quickly to a need. And so how do we pay for crisis services is an important thought. The other thing that you'll find is that our crisis system, particularly crisis call lines, is paid for mainly by Medicaid, even though all people in Washington receive crisis-related services. And so how do we think about how we fund this? And then, since I just said more people are seeking care and seeking treatment and also are in crisis and need support, we need to be thinking about our critical behavioral health workforce. There is a critical behavioral health workforce shortage going on, particularly in Washington state, also in other parts of the United States. And we're thinking about shortages of master's level clinicians, peer support specialists, substance use disorder treatment providers, and prescribers, which would be either advanced practice nurses, ARNPs, physician assistants, or psychiatrists. These are the folks that can help in these crises that we're talking about, and yet we're having a really hard time being able to retain staff and being able to hire and recruit staff, because many of them are leaving the field due to either low wages or burnout or both. And then the last thing is really thinking about equitable care and access to care across Washington state. How do we make sure that there's equitable access, and that also that the care and the systems that are offered to folks are culturally competent and sensitive to all of the populations that we serve here in Washington? So what's the BHI doing about that? Wanted to share a couple of things. What you'll notice are the little color code are for each of the pillars. So our clinical services pillar is the one that I have in yellow here. And what are we doing with that? We're actually involved and we're working together. We've partnered with a consultant group called Health Management Associates to serve as a neutral convener for the state's crisis system redesign work. And what that means is we're pulling together some steering committees and doing public comment and pulling in feedback so that we can begin to envision what would a crisis system look like for the state of Washington that pulls some of these things together, that is responsive to how things are paid for, that is responsive to what the needs are, and that brings in consumer voice and choice, as well as bringing an equity lens. The next pillar that we're talking about is the BHI training, workforce, and policy pillar. And in that area, you can see we're doing an awful lot of work, but I'll highlight a couple of areas, and that is our behavioral health inequities. And so what we're doing in this realm is really creating a landscape of what's going on from an equity standpoint and where are we with a lack of diversity in the workforce. Then we're bringing together, and we've had two conferences, and we're getting ready to have our third annual conference in September, where we're really thinking about what is that intersection of behavioral health, race, equity, and social justice. And so bringing people together. But what we wanted to do is we didn't want it to just be a conference where we all get together and talk about it and admire the problem. We really wanted to follow that up with action. And so that's our call to action training series. And this is where agencies partner together and receive coaching and technical assistance to think about what would it look like to actually make real changes within your organization to think about equity, race, and social justice. The last piece that I wanted to share with you about this pillar, the Training, Workforce, and Policy Project Dashboard, is an apprenticeship project. And that's really addressing this workforce shortage that we're talking about. We've partnered together with SEIU and with the King County Executive's Office, and also have gotten some funding through Balmer Group to establish a statewide apprenticeship project where we're developing 3 entry-level pathways for behavioral health apprenticeships. And so that is our behavioral health technician, our substance use disorder professional, and peer counselors. And by working together to develop what does that pathway look like so we can build a pipeline which brings in more people to be able to be a part of the behavioral health workforce, and hopefully we'll also bring in more diversity and make it available to be a part of this profession to more people. And the very last pillar is under construction, and that's our research and program evaluation pillar. What this pillar seeks to do is to partner with agencies in the community who may be wanting to do innovative things or think about innovative practices, but lack the resources to be able to think about how do they think about program evaluation, how do they think about value, not just volume. And so our team will partner with those agencies to develop a framework for program evaluation. So they do the innovation in the project, and we help them with getting the outcome and the data that they need in order to both receive those grants and then also sustain that work in the future. And our last piece of this pillar is around leading research efforts to develop and test innovative approaches to treatment for those who are experiencing behavioral health conditions, to widen the book of evidence-based practices and to think about what does evidence-based practice look from a community behavioral health lens. And then once we find things that look like they might be a good fit, then our goal would be to send it on over to the training pillar and to train those things out to the community so that we can all become force multipliers and we can get the new and also evidence-based practices into the hands of the people who are directly serving our communities. I really just want to thank United Way of Snohomish County for your attention and your interest in this really important work that's happening in our community and to working to help find solutions. We're so excited about being invited here today, but it's so excited mostly about a partnership that you bring to your community to say, how do we address what's going on? How do we identify it? And most importantly, how do we create a toolkit to begin to address these concerns? Thank you so much.
No, Allie, thank you. We are so lucky that your department is working for this large crisis issue that we are all facing. And I think that this is some of the questions that people have. What happens when folks fall through the cracks? And so luckily I get to ask you questions now. First question I would just ask is, what do you see as the biggest hurdle in growing the mental health workforce in Washington State? I know that you mentioned a lack of funding and also wages. I've heard this time and time again. So what can we do to increase the amount of folks going into this field?
Absolutely. So I think a couple of things. One, we do need to think about wages, right? And that comes into how is the care reimbursed and how do we rethink maybe how things are paid for in the behavioral health sphere. And so there are a few ideas that are happening out kind of on the national stage, a community behavioral health model that says, thinking kind of like how the federally qualified health systems think about payment. That's one innovative idea that's out there in the community. So think about how do we pay so that we can begin to think about what is a living wage for a behavioral health worker. But the other thing I think is also about creating that pathway, getting people excited about doing community-based behavioral health from the start, and helping people understand how does the work that they do actually help support our community and make a difference, so that we can get a diverse workforce excited about doing this work, and then also get really good evidence-based practices in the hands of the people who are doing the work.
Absolutely. I mean, it's really important that people know, and we need to share, even as a media outlet, how important it is to protecting our community, the health of our community, and all. I've heard a lot, and I've actually done stories about this, peer counseling. Can you kind of explain how peer counseling works and how we can expand on this option?
I love peer support specialists. This is actually my favorite part about behavioral health, because it's really, we can talk about hope. Me with my social work background, I can talk to you about hope. I can talk about, great, I've seen people, work through their recovery and those kind of things, but a peer support specialist is the embodiment of hope. So it's not about me telling you that people can recover and that people get into the workforce. It's about seeing someone who is actually employed in the workforce to be able to help support other folks. So these are folks who have their own lived experience. So they are working with their own behavioral health conditions, who are now in a place where they're able to help others. So it's this idea of giving back to a community that was helpful, or to say, this is what I wish was available to me when I was getting care and it wasn't. And so I'm going to actually provide that. So it's a part of someone's own recovery to say, I want to be able to give back. And then it offers this hope and this, I've been there. I've walked in those shoes and I know it's scary, and keep walking with me. And so it's so powerful to be able to help people find, a sameness, to find a peer.
I love that. Thank you. So I could even sign up to help out.
Yeah.
All right. Sign me up for that. All right. We have a question from Amanda Marie I'd like to share with you. She says, how do we increase accessibility to mental health services? I work with clients who are experiencing homelessness, and many times mental health assessments are scheduling out at least a month or two, or are they closed, or they're closed with intakes due to COVID. So how can we address this problem?
Absolutely. That's the $1 million question, isn't it? So I think the key thing is around this workforce, because sometimes the reason an agency might be closed to new intakes is that they're not able to handle the volume of folks. So the one and only good thing I can say that has come out of the pandemic, not because of the pandemic, but in response to it, is that it's become okay to not be okay. More people are beginning to reach out and to get support, and are sharing on social media. It's okay to not be okay. It's okay to seek support. That's wonderful. The problem is it is happening at the exact same time that our workforce shortage was already brewing, frankly, in the behavioral health field before the pandemic, but it has been accelerated by the things that have happened in the pandemic. And so we're in a place where we have great care, right? If people are seeking care, but they aren't able to access it because they don't have the staff to be able to open it. And so how can we increase accessibility? One, thinking about telehealth options. Can we get phones into the hands of folks who are living out on the street or who are unhoused? Can we build this pipeline so that we can create more staff who can get the support that they need?
Thank you so much for sharing this, Allie, and for sharing kind of what we're facing and giving us an idea of what we need to do to go forward. Thank you, Allie.
Thank you.
All right, folks, it is time to introduce our next speaker, Molly Fay-Cruz. Molly is the director of the United Way operations at United Way, Snohomish County, and she leads the organization's impact, investment, and equity work. Her background is in youth and family services, community engagement, and organizational development. She is a master of social work with a focus in social change and innovation from the University of Southern California, USC. Molly, welcome.
Thanks, Amity, for being our MC today. We appreciate you and the King 5 team for your partnership in this event series. It's awesome. Thanks, Allie, for that great overview of what's going on statewide, too. Your comment on dual approach of addressing present crisis and preventing future crisis. And your comment on equitable access resonates, with the conversations our team has regularly. It doesn't really matter if we're talking about Snohomish County or anywhere else across the state, let alone the country. This has been an especially hard 2 years for all of our mental health. We all need stability, connection, joy, support to make it through this. Think about all the things that make you feel stable. Maybe it's your health, your home, good relationships with family or friends, work, income, savings, time for hobbies, a car that runs, internet, the devices that you pick up to reach out to someone. There's so many things that contribute to us being able to get through this. And then there are families in our county that are navigating with only a few of these sources of stability or even none of them at all. That phrase, our best thinking got us here. CORE says, here's not good enough. We don't accept these disparities. We didn't before COVID, and we certainly don't now as gaps and disparities widen. The old way of doing things got us to families struggling and nonprofits stretched to a breaking point. So what now? Our core work, creating open roads to equity, is a journey to find the ways that we can be different and better so that families with young children in our county can escape the traps of poverty. It changes the conversation from what do families need to survive this moment to how do we create lasting change so that communities are designed for families to thrive. It really starts with working together differently, with nonprofit providers, not just as grant recipients, but as partners, and with families not as clients, but as leaders. It focuses on breaking down barriers. How do we get families what they need without them having to talk to a different provider, go to a different office for every need, one for employment support, mental health, childcare, housing, utilities, transportation, and instead having trusted places and people in the community that families can go to for support. Then, as we learn more about the barriers in our community, what bigger changes would make it so that that barrier no longer exists for families in the future? We're going to get a bit of a snapshot of that from our panelists today. What mental health needs do families have? What are we doing to meet those needs in the short term? And then what bigger changes would need to happen so we can go from helping families just beat the odds to starting to change the odds. You might specifically hear them mention a couple of our collaborative projects. Homeward House works with families involved in the child welfare system due to substance use, and then Improving School Attendance works with families experiencing homelessness whose children are chronically absent from school in Everett Public Schools. So, the core is work that none of us can do alone. It is really built on shared vision, dedication, and resources. And I'm so grateful for our panelists. They are fantastic partners individually, and their organizations are really integral in making this work successful. So joining us today for our panel, we have Cate Brewe, mental health consultant at Housing Hope, Sharon Kremen, mental health therapist at Housing Hope, along with Jill Douglas, infant mental health specialist at Child Strive, and Sarah Pulliam, director of family and community services at Child Strive. Welcome, everyone. Thank you so much for taking the time. Let's jump into some questions. So, Cate, I'm going to throw this one to you first, and then everyone will get a chance to chime in. What mental health needs are you seeing in your work right now with young children and their families?
What some of us don't realize or haven't realized until the pandemic hit is how dependent children are on the schools to provide stability in their lives, and particularly the families we work with who are homeless or marginally housed and have a lack of stability. With the schools being disrupted, I've seen a great increase in depression and anxiety in my child clients, but even more, I've seen with the parents of these children, stress that is overwhelming them, depression that is overwhelming them, And this results in them becoming unhappy and dissatisfied with their children. When you're stressed and depressed, it's harder to live with children who are acting like children. I'm hearing a lot more parents say to me, I can't do this any longer. If I'd known parenting was going to be so hard, I would have never done it. So we have basically really impaired relationships between children and parents right now. We need to get more mental health services to them. Most of our families have major transportation problems. These services need to be going where they are going. And because these are people that are highly mobile, part of the nature of being homeless, these services need to be able to go from location to location and follow our clients wherever we go. With the isolation that's come with the pandemic, we also need group services, particularly for our children, mental health services to reduce the isolation, increase peer contact, which is so important for their development.
Absolutely. Sarah, can I pass it to you next?
Absolutely. I agree with everything Cate said. And I also wanted to underscore the fact that children are not just small adults. One size does not fit all in mental health therapy. So what we're also needing is the ability to treat parent-child dyads, as Cate alluded to, in their relationships. We also need targeted approaches that really address the issue that the children are having. So embodied trauma or compulsions or issues around peers or attachment. These are not just skills that all people graduate with the ability to handle right off the bat. It's very directed and targeted. We also need providers who can work with children and families to really engage them and build trust. Everyone needs to have affinity with their counselors as well. So whether that's on the basis of race or immigrant status, sexual orientation, you name it, you have to feel comfortable and you need to be able to trust the person that you're working with. So those are additional special needs that we have in our community right now.
Definitely. As you can tell just from this panel, it's a field dominated by white women. And that does not support equitable access in the way that you're talking about. Jill, can I pass it to you next?
So, yeah, Molly, I just want to piggyback off that too. Like, I 100% agree. Like, training programs, like at UW and Harborview, for example, should be focusing on training more people of color and providing more access and avenues that help people from diverse backgrounds to do the work that we're doing. And people should be paid enough to do that. And yeah, I think it's really tricky. Some other things, like I 100% agree with Sarah, like providing parent-child therapy is so unique and it really shouldn't be. Like, we need more people trained in working with little people, not just working with adults and bigger kids. And then lastly, just like making sure that basic needs are met is really hard right now. Like right now where I work, we have multiple families that aren't able to be homed with their children because we can't find them long-term housing that so basic needs like housing, food, and care, like daycare, preschool for little ones is super important. And it's hard to even be able to focus on mental health when those basic needs are not met.
Yeah. Sharon, let me pass it to you next.
Sure. I'm going to kind of echo already what everybody said. We all know that our families have lost a lot during this pandemic. It's showing up in increased anxiety, depression, both in adults and kids. Sadly and disturbingly, there's a rise in suicidal ideation, self-harm behaviors, eating disorders, and I'm seeing that rise increase, especially with children. Kids were already stressed out from dealing with their own personal traumas, as well as the societal traumas that are inflicted on them through social media, right? Cyberbullying, school shootings, gang violence. And once the pandemic hit, their worlds kind of turned upside down and they lost a lot of their supports. So now more than ever, and I really want to stress this, we need mental health services and social supports for our younger population. And also, again, to echo what others have already said, I want to emphasize that you really can't separate a family's mental health needs from, their other needs, right? Like when they're struggling to obtain housing and childcare and employment and food and transportation, they're going to have a hard time focusing on their mental health. Since the pandemic, those needs have increased exponentially. I've seen it take a toll on all of my clients' mental health. So we're going to have to take an all hands on deck approach with this. We need to start thinking more creatively and absolutely collaboratively to help address all of these mental health needs in our community.
Yeah, that's such a great tie-in to our next question. Sharon, I'm going to go in a bit of a reverse order and throw this one back to you first. Give us some examples about how you're addressing these needs in your work with the core collaboratives.
My clients belong to the Improving School Attendance Collaborative. They have been hugely instrumental in helping provide just a total wraparound services to all of my clients' needs, which has improved their mental health greatly. I make sure to take advantage of all of the supports that they offer when I meet with clients and they tell me about some of the hardships that they're having. I'm on the phone or on email with my the child and family advocates or the collaborative coordinator, expressing to them what the needs are, and vice versa. They do the same thing with me. They tell me, when they're working with the families, what they might need. So, we maintain frequent check-ins. They accompany me to school meetings sometimes with my younger clients. They're hugely supportive in that. They connect with teachers. They connect parents to the schools as well. They brainstorm, troubleshoot. It's really just an awesome resource for families. And I notice that when they have those other needs met that the collaborative and partners are able to help with, that their mental health improves. Their anxiety, their depression levels are reduced. And, when parents are supported, when they feel supported, it improves their mental health, which then improves the mental health of their children too. So it's an excellent, excellent, excellent system.
Kate, do you have anything to add from the improving school attendance perspective?
I actually do. Most of my mental health clients with improving school attendance are either the parent of a young child or a parent-child dyad, working with the two together. I've always met in community settings. One of the things that we've had to do in the last 2 years is increase our flexibility in where we meet. I go wherever the family is most comfortable. We're utilizing at this point school settings to provide mental health services, family homes, community center, recreation rooms, libraries, occasionally McDonald's. So we have expanded where we'll meet and where we'll see clients, which has opened up mental health services to many families. In addition to mental health services, I also provide parent support services through Parent Trust to the Improving School Attendance Collaborative. We always used to do this in a group model with the parents meeting as a group. Because of the pandemic, we've moved that to an individual model where all of the parents who have indicated they wish parent support services are now either have time on the phone, time in person, or time in Zoom with me regarding parenting issues and parent coaching. This is for Parent Trust, this is a great switch from our group model to having to move individually, but it's one that we have done. We have also started I'm sending out to all the members of the collaborative on a regular basis information about community services that are available to them that they may not be aware of. Things like letting them know if they go to the farmer's market that they can utilize their food stamps to get double the dollar amount of food, because they need to be out. Just being out in the community improves their mental health, and they need the support of additional food, and that improves their mental health. So trying to creatively think of ways like this to allow them to work on their mental health. Yeah.
Thank you. So we are, getting close on time. I want to head to the next question. Sarah, Jill, do you have any quick additions to that about your work with the core collaboratives before we move on? Oh, all right. Well, Sarah and Jill, let's start with you on this next question. This work provides really amazing direct support to families. What other bigger picture changes would you like to see in our county to support the mental health of families? Sarah, let me toss it to you first.
Sure. Well, I think similar to what we've already mentioned, our county has not chosen to really invest in childhood services. A lot of attention has now come to the ACEs research, which is looking at how our experiences in childhood may affect us for the rest of our lives and show up in health conditions and shortened lifespans and risk behaviors. And so with that additional emphasis, I found it interesting that we continue to sort of treat further downstream instead of trying to work upstream in the life of a family to provide treatment and alleviate symptoms that kids are feeling because of major disruptions in their life or traumas that they experience. So we really need to do a better job. I know the schools are working very hard to do that, but I think a more integrated approach across the county and medical systems of care could get us a lot further. And I would say, we are also learning that kids are more resilient than we would have thought. And so why wouldn't we capitalize on that and work, again, earlier in the life of a family to help get them on stable footing and invest in their recovery?
Thanks. Jill, do you have any kind of bigger picture hopes and dreams to add?
Yeah, I 100% agree with Sarah that focusing on prevention instead of downstream effects is super important. So like adverse childhood experiences impact us throughout our entire lives. Like we're 12 times more likely to die by suicide, hypertension, diabetes due to, and all of those are related to early traumas. So if we focus on preventative services and providing the things that all families need, like universal housing, preschool, and access to medical and mental health services, we would have so many less big problems, not just here in our community, but in our whole country. 77% of kids in foster care are there not due to physical or sexual abuse, but due to reasons relating to poverty. So families need more access to basic support systems that in order to thrive.
Absolutely. Those early years are really a critical time to invest and can change the trajectory of someone's entire life. And that's why it's really important for us to talk about, why is core 0 to 8? There's a very specific evidence-based reason that we chose that age range. So thank you for bringing that up, Jill. So last question, I'm going to jump back to you, Sarah, to just quickly touch on what are the challenges you're seeing in the mental health workforce?
Yeah, so similar to what Allie Franklin was talking about in her keynote, we experienced a shortfall in behavioral health specialists before COVID. And then with the increase in demand for services, we really are finding ourselves in a position where when we have the ability to expand services, it's very, very difficult to hire someone with the right qualifications. I think that there's another effect too here of, as you pointed out, we happen to be on the panel, a lot of women. Women are leaving the workforce because they don't have childcare. There are a lot of things that we could do to shore up what the workforce looks like for women right now, which would indirectly really help behavioral health and human services. As mentioned before, it's not a really good combination when you have both high demand and a fairly low budget for mental health. The poor reimbursement for services is also something that we need to look at systematically. It's often Medicaid that is targeted as the lowest payer for services, and that is a significant problem. Not very many providers who are working in private practice will consider taking Medicaid as an option. They're not able to meet the basic, needs that they have to keep their lights on and pay themselves for the work that they do. But it's also other insurance companies as well. One of the good things that has happened as a result of changes to healthcare policy is that mental health is supposed to be treated in the same way as other physical ailments. So that should allow people to have more access to mental health counseling. However, that mismatch in terms of being able to find a provider that not only can treat this very specific needs or age group that you are, but also is covered by your insurance, it's a very, very difficult dance. And when people are in a place where their mental health is poor, it's very, very hard to go do all of that legwork. Find a provider that has space, that accepts your insurance, that can help you when you need it in the time frame that you need it. Right now, I know Child Strive, we're doing our part to try to help with increasing the community's capacity to work with children and families. We have taken a University of Washington School of Social Work student for the last 3 years. We're talking a little bit about considering a fellowship program to help train the next generation of clinicians to be able to do dyadic work with families. But all of these things together are really putting us at a disadvantage in terms of meeting the huge need that's out there in the community right now.
Absolutely. This is a really tough time. Like you all said, it's high demand and, a really kind of precarious mental health workforce and system that's set up. It's really stressing all of our systems right now. Thank you so much for all that you've shared, your expertise, and all that you do for our community. The mental health supports you make possible for these families are really impactful. I'm grateful for your partnership and excited, also very daunted by our challenge of how to tackle the system, how to make it more supportive of families and of you all. So thank you so much for your time today. And Amity, let me throw it back to you.
Ladies, 100% echoing Molly's thoughts. Thank you for your time, but literally thank you for all that you do. I'm a hugger, and I'm virtually hugging all of you right now for the work that you've put into this. Thank you so much for being with us today. And we've really learned so much over the last hour that we spent together. We've learned of the crisis that we're facing. We've heard comments. Thank you for sharing your comments, echoing the same sentiments expressed in our conversation today. And it's really hard to ignore now the dire need for solutions. Hearing about kids suffering is absolutely crushing. And it's a motivating factor for all of us to get involved. Children of the future, they wrote a song about it. It is our job to support them, to support the society going forward. So such important work going on. So please help us to advocate for work in our community. Subscribe to our Core Connections e-newsletter on our website to hear more about the work in the coming months. And of course, again, you can donate at www.uwsc.org. We've added a link in the chat, so you can just go there, super easy peasy, and donate. And finally, thank you to our keynote speaker, Allie Franklin from Behavioral Health Institute at Harborview. Your insight into the trends and the needs in Washington State has really been invaluable. And thank you to our own Molly Fay-Cruz and your team for all the work you do into supporting CORE. And most of all, thanks to all of you for being here, for taking the time to listen to what we've got to get through. It's been a tough couple of years, but together we can get through anything. Thank you so much for your time. Have a wonderful day.